think sometimes it's easy to just write them off as, oh, I'm getting older, and they're kind of subtle sometimes, so you feel like, oh, I'm just tired. But over time, it just got worse. And really, when it got to the peak of it, when I was feeling really bad, I had like pressure on my chest. It almost felt like a 5-pound weight was on my chest.
Welcome back. You're watching the Dr. Nandi Show. Many times my patients complain about feeling tired and sluggish. Now, these are very common symptoms that can be attributed to a number of conditions. However, it could signal a thyroid problem. My first guest considered herself a healthy person, worked out and ate right. So she was very surprised when she was diagnosed with thyroid disease. Please welcome to the show, Linda Stenonis. Linda, thank you for joining us.
Thank you.
I appreciate it. So what happened? Tell me about your journey and how you discovered you had thyroid disease.
I will say the symptoms were a bit subtle at first. Over time, I was feeling more sluggish. Anxiety was kind of creeping in. I was gaining weight. I think sometimes it's easy to just write them off as, oh, I'm getting older, and they're kind of subtle sometimes, so you feel like, oh, I'm just tired. But over time, it just got worse. And really, when it got to the peak of it, when I was feeling really bad, I had like pressure on my chest. It almost felt like a 5-pound weight was on my chest. I was just uncomfortable on the inside. I was anxious. I felt shaky all the time, but you couldn't see that I was shaky. I just felt very weak.
You felt at unease, didn't you?
I knew something wasn't right.
Yeah.
I knew something wasn't right, and so you kind of try to explain it off as, I'm getting older.
Especially because you did everything right. You ate right, you worked out.
Right.
Like, this shouldn't happen to me. So what happened? How did you find out what was going on?
I finally went to the doctor. Blood tests showed that I had low thyroid, so I started medication, but I will tell you.
And what kind of thyroid condition? Were you underactive?
Yes,
Okay.
Hashimoto's.
You had Hashimoto's,
Yep.
so they diagnosed you with Hashimoto's. And what did they tell you that was?
From what I understand, it was more of just something that you have to be on medication all your life, but I didn't know a whole lot about it from what the doctor said.
And that's all they told you?
Yeah.
Yeah.
And I will tell you, then I started my own research. Then I really
What did you find out?
Well, first of all, there's a lot of stuff online. There's a lot of people who post things. That was kind of bad for me because people were posting things that were very, very, very serious, and that scared me. So I learned to kind of pull back and read when I felt ready to read what I needed to read. But there's some good books that I really felt like, okay, I'm drawn to this book. They're putting in layman's terms. So I really appreciate that, but I also learned what I can do to correct it.
And I'll tell you an important point that Linda's making. Online, you'll find a lot of stuff, and sometimes a lot of crap too. You have to really use your judgment, because a lot of people out there just trying to scam you, and you have to know that. So what I would say, a rule of thumb, is that reputable sites that have research-backed stuff, so people are just making claims that I talked to my friend or this happened to me and that's it, is not enough. So you really have to find out and do your own work. If you don't do your own work, you could really get sick, because people will give you all kinds of regimens. How do you feel today, and what did you do to rejuvenate your health?
Well, once I started the medication, it honestly took about 8 weeks for me to kind of get back to what I felt comfortable doing. I really could not go to the gym for several months.
Oh, okay.
But that was okay because I was resting and I was recovering. But now I've kind of learned like what I should avoid food-wise. I learned to listen to my body. If I'm tired, I just stop and I rest. So listen to your body, that's the only thing, but you know when something's wrong and you have to take care of it. You can't put it off. Like, I kind of put it off.
You've got to be your own health hero. We talk about this all the time for those who are watching, and she did that. She said, you know what, something's not right, and she went for it. And what kinds of foods do you avoid? What is your life and diet like right now?
I really try to eat clean. I will focus more on, like, if I go to the store, I'll buy the chicken that's the organic kind of chicken. I read the labels now. I'm like, you know what? My body's worth the extra money to spend on these kind of groceries for myself. So I just don't eat processed food anymore. I really just keep it clean. And you know what? It's easy because there's a lot of really incredible foods when you get used to strawberries and blueberries and bananas and all those things that taste delicious.
I'm so glad you said that.
Yeah.
You know, people think that it's a sacrifice to eat those things, but they're really amazing. And we say that for everybody, but really, when you have diseases that are autoimmune, and you know, Hashimoto's thyroiditis is an autoimmune disease, about 30 seconds, what advice do you have to give to other people with thyroid disease? And you said listen to your body. What else would you tell them?
Figure out food triggers for yourself. There's probably something going on with the food you're eating that may be a trigger. Just start listening to your body more and give yourself permission to seek treatment, seek medical attention, but also to rest when you need to rest.
Absolutely. Give yourself a break sometimes, because
Yes.
we're always going. Treat yourself right. Make sure you drink lots of water. Also, make sure you have spirituality in your life when you're doing this, because being still is so important, because people are always going all the time. And it doesn't mean that, you have to always be doing something in order for your body to actually benefit. When you sometimes don't do as much as your body gets to heal, the cortisol decreases, inflammation decreases. Thank you for sharing your story. That was amazing. And a lot of people are going to, relate to what you're saying and really change their lives. I appreciate that. Hi everyone, I'm Dr. Partha Nandi. And if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.